Hello, I'm Vimala Thiruvengadam. People call me by my middle name Sudha. I am a senior physical therapist in New York Spine and Sport Rehabilitation Medicine, and I'm happy to announce that we offer pelvic floor physical therapy for women. I know many of us don't like to talk about it, like a leak or a pain in the genital region or an itch in the genital region. Individuals who are suffering with any of these symptoms, like a urinary or a fecal leak or a pain or an itch in the genital region, don't think that you are suffering alone. If you are ready to discuss, then definitely there is help. I have some questions. I want you to go over the questions and see if you say yes for any of these questions, then definitely I think you will need to meet a pelvic floor physical therapist. I will let the questions run over for you, but I'm going to ask you some of these questions. Do you leak urine or fecal matter while sneezing, coughing, or laughing, or bending forward, or any regular activities of your daily life? Or do you feel like something is coming out of your vaginal opening anytime you stand for long hours? Or do you feel like you are sitting over something when you sit for long hours? Do you have pain, like a chronic pain in your lower back, which is not relieved by any form of treatment? It can be therapy, medication, or any other form of therapy. Or pain in your tailbone, pain in your groin, pain over your surgical sites, like following a C-section or an episiotomy. And these symptoms can happen to anyone. You don't have to think that it can happen only in an elderly woman. It can happen to an young athlete. It can happen to an active individual who's on her feet always, or an individual who's doing a sedentary work but still active. So it can happen to anyone. So don't confuse yourself that only it happens in elderly women. What is it about the pelvic floor that I'm going to discuss? Before, I want to tell you that the pelvic floor muscles are a small group of muscles which is not given much importance, but they have three important functions. The first important function is the pelvic floor muscle. They act as a cushion and hold the genital organs, the reproductive organs, or the urinary bladder, which is present in the pelvic cavity. Number two, they control continence by contracting and relaxing the sphincter muscles. Number three, they help to appreciate and respond during sexual activity. If there is a derangement in these muscle groups, that's when an individual develops symptoms like a urinary or fecal leak, or a pelvic organ prolapse, where you feel like something is coming out of you, and chronic pain in the lower back, which is not relieved by any form of therapy. So when you see your physician, it can be your primary care physician, it can be your GYN, your urogynecologist, or a neurologist. Unless you discuss this with them, they are not going to know about it. Talk to them about these symptoms if you have any of these, and ask them to refer you to a pelvic floor physical therapist. Like I told you before, if you are ready to discuss about it, help is definitely available. In New York Spine and Sport Rehabilitation Medicine, we offer private one-on-one sessions for women with pelvic floor issues. We work closely with your insurance companies and our referring physicians. Thank you.